as of yesterday by the Health Minister, Dr. Zweli Mkhize. This means that our province has 42% of all confirmed COVID-19 cases in South Africa. We have also lost 3 of our residents in this battle against COVID-19, and I would like to take this opportunity to convey our condolences to their families. We are deeply touched as the people of the province and the provincial government, and we wish the families healing at this difficult time as they mourn the passing of their loved ones. Now, being an epicenter of COVID-19 in our country imposes a burden of responsibility on us as a province. We have a heavy burden of responsibility on our shoulders. We must lead the fight against this invisible enemy and have to work with all sectors, leaders in various sectors of our communities, various sectors of the population in our province, to save life. Say that worried about what normally happens. A lot of our people get cold and influenza. And in the face of COVID-19, this can be a very tough winter we are going to face. Consequently, the provincial government has undertaken tasks, and one of those tasks is that we now have 8,005 community healthcare workers who have been trained. A week ago, we said we had already trained 4,000. We have doubled the number. So we will soon reach all our community health workers. We have 9,000 community health workers. We have now trained 8,005, that is 8,005, 8,005. We also have 607 health professionals that are involved together with these community health workers in tracing contacts and in conducting screening and testing. We want to give you an update that since the 31st of March, when the President made an announcement just a day or so before, that we need to upscale screening and testing. Since that time in Gauteng, Since the 31st of March, we have screened 26,841 people. Out of these people who were screened, 440 displayed symptoms and were therefore referred for testing and were indeed tested. Dr. Masuku will explain later the relationship between screening and testing and tracing. So having screened that number since the 31st of March, we also identified this intensive campaign of screening and testing. We identified where we should launch it, and we launched it in Stwetla, in Alexandra, on the 31st of March, wherein we screened 1,693 people right there in Alexandra, in Stwetla. And out of the 1,693, 201 were tested. Again, when Dr. Masuku speaks, he will explain the relationship between starting first with screening to identify symptoms and then putting people to testing. So in Stwetla, our health professionals tested 201 people, and only one person tested positive, and that person is now in quarantine. We thank the people of Stwetla for coming out on that day and for volunteering themselves for testing and for screening. It wasn't easy. Many of the people there we interacted with came to the fore and said they would love to know their status. We know that Stwetla is the area where one case of someone who tested positive interacted with a lot of people before that person left for the province of Limpopo. So we are very happy that the community of Stwetla cooperated with us, and that we know we are going to continue to work with that community. In fact, there's since been a follow-up by our health professionals. They went back to Stwetla after we did the test, because we want to continue to provide medical surveillance of that area. If we find that an area may have been exposed to risk, even after testing, our health professionals will continue to provide medical surveillance to ensure that we are not surprised by any other new developments in that area. The screening and testing campaign has now been rolled to all 5 districts of Gauteng. It is 2 districts and 3 metros, but using what is called the district model, we now call all of them districts. So our health professionals have gone to Johannesburg, Tshwane, Ekurhuleni, Sidibeng, and the West Rand. And in those areas, there's a specific target. They are not going to every community indiscriminately at this phase of our screening and testing campaign, but they target high-density contacts. If there's an area, through the work that we have been doing of mapping where the people who are positive are, and mapping where the largest number of contacts or people they came into contact with are, we map that, and the deployment of the screening and testing teams that are led by our health professionals are also directed towards the areas where there's high density of contacts. And this may be a suburb, or it may be a township or an informal settlement. But the screening teams and testing teams are also going to areas of high vulnerability. There are communities where there may not be contacts, but using a multiplicity of factors that we identify to look at vulnerability, the screening teams also go to those communities. And I must say that so far the screening teams have been to communities that are for those who are relatively well off and for those who are poor. I know particularly in a region where the screening team went to a suburb. In terms of the regional breakdown, I also want to say that from now on, we will, on a day-to-day basis, give the breakdown of these 5 districts in Gauteng. When the numbers are coming, and we wait for the numbers from the Minister of Health, he is the only one who's got the authority to announce the numbers on a day-to-day basis. We wait for that, and once the numbers are announced, we do a breakdown region by region in our province. So far, in terms of those cases of people who have tested positive, as of the 8th of April, and these numbers would hopefully, or normally as we do, will change this evening when the minister releases new ones. Johannesburg is the epicenter of COVID-19 in Gauteng. So if Gauteng is the epicenter of COVID-19 in the Republic, Johannesburg is the epicenter of COVID-19 in Gauteng, with 440 cases, followed by Ekurhuleni with 111 cases, Tshwane with 90 cases, West Rand with 12 cases, Sidibeng with 6 cases. Now we have an additional 123 cases that are called unallocated. I would like Dr. Masuku to explain, as a medical practitioner, what these unallocated cases are, because we have a complex of institutions in Gauteng. We've got public laboratories that do tests. We also have private laboratories that do tests. So when we do reconciliation of the numbers and get confirmation from the NICD, the National Institute of Communicable Diseases, we look at all those, and we always able to reduce the number. On a day-to-day basis, the number of unallocated gets reduced, but Dr. Masuku will explain. So we are certain that those are people in Gauteng, but there may be a question about in which of our 5 districts they live. We also want to report that we have improved and enhanced our capacity to trace contacts using technology. And so far, we have been able to trace 90% of all contacts. Now, this is very important because COVID-19 spread on the basis of people who have come into contact with those who have coronavirus. And some may have symptoms and others may be asymptomatic. So being able to trace those who have come into contact with those who have tested positive is one of the key things that the world, all countries, all jurisdictions are battling with this, that the capacity to trace all the people who may have come into contact with someone who have tested positive, it's very, very important in order to cap the spread of COVID-19. So as I say, so far we are happy. We hope We will improve above 90% in tracing all contacts. As we continue to, so far we are using our own technology. There is a national process to help us deploy additional technology to be able to do medical surveillance of those who are positive and who